everyone. Welcome to World Insight. I'm Tian Wei. The World Health Organization says the Omicron variant has spread to 19 countries, with confirmed COVID-19 cases worldwide surpassing already 262 million and over 5 million deaths. Global vaccine makers have announced efforts to upgrade vaccines against Omicron, with China's CanSino and BioNTech announcing they began data collection and analysis. Pfizer BioNTech also started work on the variant. On Friday, Johnson & Johnson confirmed it is testing the efficacy of its vaccine against Omicron. So far, what do we know for a fact about the new variant and how effective the current vaccines are against it? I earlier spoke to Jerome Kim, the Director General of the International Vaccine Institute. Let's listen in. Dr. Kim, tell us more about how vaccines are going to function under the current circumstance with the Omicron, the new variant.
Omicron is interesting and different. It has far more mutations than the other principal variants of concern. The spike protein, that mushroom-shaped knob that sits on the outside of the virus, for Omicron has up to 25 individual mutations. There are first, those mutations that we think makes it easier for the virus to spread in human populations. So mutations that make the virus more transmissible. The second set are those that make it easier for the virus to enter human cells. These may be important to may make the virus infection more severe. Then there are mutations that may make the virus more resistant to some of the protective immune responses that we get when we're infected, when we're vaccinated. Then, over the next 10 to 14 days, you'll start hearing about the test tube. And then finally, in the order of months or so, we'll probably start to hear of whether this new virus, this Omicron variant, causes more severe infection. So when it comes to the vaccines, it's probable, in fact, that the vaccines still offer some level of protection, but we really don't know how much.
We do not know, as to this point, how much vaccines over the past few years have helped us in terms of percentage of preventing progressing of COVID-19. Do we know or not?
That's a great question. So remember when we did all those big phase 3 trials, this was last year, and we were analyzing 30,000 volunteers in some of these clinical trials. And that actually told us pretty clearly that the vaccines reduced or prevented mild to moderate disease and were safe. And then now we've dispensed almost 8 billion doses of these vaccines around the world. And we have pretty good evidence for all of the WHO approved vaccines that they, in the real world now, this is real world evidence, reduce severe infection, hospitalization, and death. So yes, the vaccines are very good at that. And it's very important that as many people around the world have access to these vaccines as possible. And this is something that Omicron illustrates so well, as Delta did before. And that is that outbreaks cause variants and variants cause outbreaks. And until we can break the cycle of variants and outbreaks, we will always be threatened by something that we don't know is going to arise.
But on the other hand, Dr. Kim, we see that many of those patients who actually eventually got COVID-19, particularly with Omicron recently, they are already the ones being vaccinated.
So remember, the phase 3 trials looked at the ability of the vaccines to prevent mild to moderate disease that was PCR positive. They didn't really look at the ability of the vaccines to prevent infection. And in fact, most of the vaccines that we use today actually prevent the manifestations of disease rather than preventing infection. Data from the United States says, compared to people who are not vaccinated, people who are vaccinated have an 11-fold decrease in the risk of death. And that is borne out over time. It's not an effect that disappears. So it's a very important point to make to people to protect yourself.
Which is more effective, to have a third dose for those who already have 2 doses of vaccines approved by WHO, or to have the rest of the world with certain speed having their first and the second doses of vaccines to you?
Yes, so if we were back in January, equity and access were front and center. Equity and access are still important, but one of the things that we sometimes lose track of is companies are now manufacturing between 1.5 and 2 billion doses of vaccine a month. WHO estimates perhaps that maybe by the middle to the late part of next year, 70% of the world will be vaccinated. So the problem is going to get better because we have greater access to vaccines. And some of the new vaccines, for instance, the vaccine from the Chinese company Clover, but a Korean company and a French company, Sanofi, are testing similar types of protein-based vaccines, appear to have very high levels of protection. And not only that, they have the very interesting now proof that if you were already infected and you're vaccinated, you have even more protection than infection alone. And I think all of these things are making a very strong case that we should vaccinate everyone as quickly as possible. We have a lot of vaccine. The issue is distribution. And we'll increasingly have more vaccine as the year ends and next year starts. And we have to make sure that some of those vaccines are getting to the people who need them in countries around the world.
Right. That is given if things like Omicron did not go beyond our imagination, or in other words, did not go beyond the level of infections and the infectious degrees than the earlier variants, right? If it did, or if other new variants after that, or at the same time appearing, did that, then all these numbers will have to be changed.
Yes, and you're making a very good point, because one of the issues that we always talk about the shortage of vaccine, or the fact that vaccines are not equitably distributed. But last year, WHO and another product development partnership called FIND published a report that said there's a diagnostics gap. The diagnostics gap is $2 billion. And it means that in some parts of the world, in sub-Saharan Africa, we don't have enough kits. We don't do enough diagnosis. If you were to look at a map of the world where the hot spots are now, and you were to look at Africa, it doesn't look like they have many infections, yet that's where Omicron came from. So one of the things that the wealthier countries can do is to work to develop the capacity to improve diagnosis in all countries around the world, and also to improve the tracking of mutants. So and I'm going to use this data from the GSAID database, in the month before the emergence of Omicron, Africa submitted 200 full-length sequences. Europe submitted 161,000. So if we were to improve the ability of the countries in sub-Saharan Africa to make diagnoses and to do sequencing, we would greatly improve our own ability to know when these variants that you mentioned and that we're very concerned about will emerge. We don't know yet about Omicron. Is it more infectious or not? Is disease more severe or not? You know, some people are saying, well, most of the people that we've seen with cases of Omicron have not been that severe. Remember that many of those people were vaccinated, and that's exactly what vaccination does. It keeps you from having a severe case of COVID-19.
Let's just assume, Dr. Kim, that the vaccines that we talked about, mainly approved and recognized by WHO, did work. However, the duration of time in which it could work actually could be suggested not as long as we want. That's why we need to have an extra shot. But the question really is, how many extra shots can we afford?
So do we really want to be giving people vaccinations every 6 months? And I think you're absolutely right. The answer is no. It's impractical. And so we need to find, and again, this gets to the idea that science should never stop just because we have the vaccines that we have now. The hope for the future may be that there are groups that are working on what we call universal vaccines, or vaccines that should work against future mutant viruses. And if we have those, then potentially we'll have the vaccine that should protect us against the most commonly or most likely to occur set of mutants in the future. And then there are even groups that are even farther along and working on what we call pan-coronavirus vaccines. So vaccines that might work against MERS or SARS-1 in addition to COVID-19. And those vaccines, although they're still early stage, again, have the potential to protect us against a broad class of viruses.
Different kinds of control and prevention policies. For example, China has a zero tolerance, quote unquote, policy, while other countries have already have seen a tremendous amount of cases of COVID-19. Of course, there are making populations that are COVID naive, populations that are not necessarily so. So what does that mean for vaccines functions on these different populations? Do we know much? Are we doing research about that?
We are using what we call real-world evidence. That is data from the implementation of vaccination massively in countries around the world. So, for instance, Israel has been very effective in publishing and publicizing its work in vaccinating nearly its entire population. The United Kingdom, because it has vaccinated such a large proportion of the population, has been able to provide us a lot of very important information. Well-designed studies from the United States and other countries around the world are giving us really good insight into what it takes to protect people for longer periods of time. And I have to point out, the best guide to policy is to use information that we can collect, to devise plans, and to devise plans in case our initial set of plans don't work. So to create a set of plan B. And sometimes countries have released all regulations and not had a backup plan. And then you have to explain to a population why you have to engage in lockdown again, or why you're going to have to require vaccination in order to go to the supermarket or go to a restaurant. These are the kinds of things that we should use our data to model, to predict, and to develop better policy.
And the Winter Olympics is coming. The Summer Olympics in Tokyo was actually celebrated by all over the world. So how do you see, at a time of such a big international events, prevention and control can be done, and vaccine work, the role of it could play?
I was very worried about the Summer Olympics, and I'm worried about the Winter Olympics. Whenever we have large crowds of people, we have the risk for large spreading events of COVID-19. It is possible, though, to use the best science that we have information on. So I think that it's possible to minimize risk, not possible to maybe eliminate risk, but to minimize the risk of large outbreaks. Vaccination will be a part of that. Masks will be a part of that. Controlling crowds to the extent that that's possible and keeping people from high-risk exposure situations. We have to use the best science that we have in order to control risk during important events like the Winter Olympics.
Jerome Kim, as always, thank you so much.